Hello, my name is Ralf Friedrichs. I'm an addiction recovery coach and the host of the Take Your Life Back Today show. As an addiction recovery coach, I want to share something with you, and let me be crystal clear to leave an everlasting impact upon you. Just imagine being buried alive. You're in a coffin, but you know you're not dead. You don't know how to get out of that coffin. You tried lifting the lid, you can't move the lid because of the enormous weight upon the lid. You bang on the lid to hopefully unsettle the dirt so that maybe somebody will notice the dirt moving around and start digging their way down towards you. It doesn't work. Now, you have an addiction. You know you need help. You know you can't do it on your own. You don't know where to turn. So you waited and waited until it was too late. You just think you're going to die now. Usually, though, people don't think about death when they're habitually abusing drugs and alcohol. In order to feed an addiction, you have to be great at repressing the fear of death. I often ask you, my audience, did it ever cross your mind when you were abusing drugs and alcohol that maybe, just maybe, you might overdose and take something away that God had given you, called life? With this, let me leave one last thought. Don't be like the person that I'm reading about on these index cards that waited and waited and waited until it was way too late, and they went to their grave. Instead, pick up the phone and call me at 844-405-HELP, and I promise you I'll help you take your life back, for your life is gone. Larry Geis, 516-458-2741. Larry Geis is an addiction recovery coach, a life coach. Him and I tell people like you, it doesn't matter where you came from, it doesn't matter where you've been. All you need to do is pick up the phone, call 516-458-2741, and Larry will help you. Go to his website, www.odysseyconsultant.org. Larry will take you from addiction to recovery, depression to happier times, low self-esteem to raising your self-esteem. Larry Geis from the Geis Academy, 516-458-2741. Folks, don't forget to take your slippers off at night. Don't put them by the edge of your bed. Stick them way under your bed. In the morning, you're forced to get on your knees to go and retrieve those slippers because you don't want to walk on that cold floor while you're on your knees. Ask God for guidance and direction, mercy and forgiveness. Thank God for sceneries like the flowing river or lake and the waterfall. Thank God for having a home, clothing, food, relationships. Ask God to protect you throughout the day, the week, and protect your whole family. Then put on those slippers, stand straight up, roll your shoulders back, stick out your chest, and walk with God 24/7. I call that an email. Every day I pray, and that's my personal chat line between me and God. And I pray for whatever comes out of my heart. There is no set schedule. Do that today. Give me a call at 844-405, and I promise you I will help you take your life back. Imagine the next time you go to the doctor to get a physical, and well, you're told there's a new tool that can estimate your risk for many different diseases. Well, we're going to talk about 10 questions some doctors are afraid to ask you. Questions about heart disease, diabetes, depression, addiction, just to name a few. It's not a crystal ball, but might hint at your vulnerability to disease and mental illness if the doctor could just ask you anything long before you start smoking and drinking, gain a lot of weight, develop high blood pressure, or actually get sick. And all you have to do is answer 10 yes or no questions about your childhood. Answering those questions would give you an adverse childhood experience score, or an ACE score for short. The test proponents say that it provides a rough measure of your tough childhood and some of the experiences, death of a parent, childhood abuse, or neglect, that can have a long-term effect on your health. Dr. Vincent Folletti of University of California, San Diego, who did much of the research that gave us a rise and an instant to the ACE score. He thinks the tool is so useful it should be part of a routine physical exam, but it's not, for a variety of reasons. For one thing, doctors aren't taught about ACE scores in medical school. Some doctors wonder at what point would it be, as the past can be undone, so why would they need to do that? There's also no way to bill for a test like that, and no standard protocol for what a doctor should do with the results. But Folletti thinks there's an even bigger reason why the screening tool largely has been ignored by American medicine: personal discomfort on the part of the doctor. Some doctors think the ACE questions are too invasive, Folletti says. They worry about asking such questions that lead to tears and relived trauma of the patient, emotions and experience that are hard to deal with in a typical time crunch office visit. I wondered if those concerns were warranted, so with the permission of the patient and the doctor, I sat on an appointment, and I want you to listen to what happened and how the doctor spoke to the patient. So let me get on to that right away.
Imagine the next time you go to the doctor, you're told that there's a new and very simple way to predict your risk for depression, addiction, heart disease. All you have to do is answer 10 yes or no questions about your childhood. Yesterday in our program, we heard that in theory this could happen thanks to something called an ACE score. Rob Anda is one of the 2 doctors who helped develop it.
When I saw the numbers, I thought that people would flock to this information, and the initial reaction was really silence.
15 years later, as Laura Starcheski reports in the next installment in our series, What Shapes Health, that silence persists.
Dr. Vincent Felitti, the other doctor who helped develop the ACE score, believes it could still be a game changer in American medicine, the key to helping doctors take much better care of their patients. But
in terms of medical practice, it basically has been avoided. It has gone nowhere. And the question really is why.
There are actually a lot of reasons why. It's not taught in medical school, there's no way to bill for it, there's no protocol for what to do with the results. But according to Felitti, those are all just excuses.
The real reason,
listen to this,
is one of personal discomfort on the part of physicians.
That's because ACE stands for Adverse Childhood Experience. Your ACE score is a tally from 0 to 10 of whatever bad things happened to you as a kid. Sexual abuse, physical abuse, addiction or mental illness in a parent. Felitti spent a couple decades studying the ways these experiences can affect our health long after childhood. His research shows that the tougher you had it as a kid, the higher your ACE score, and the higher your risks for disease, mental illness, and early death.
Things will be coming up
These
now.
are risks that are really useful for doctors to know about.
Absolutely.
But Felitti says that when he talks to physicians about getting ACE scores, they say things like,
"My God, I can't do that. I can't ask questions like that. That's opening Pandora's box."
They worry that these questions will mean emotions, tears, relived trauma, things that are hard to deal with in a regular doctor's visit. I wanted to see if that was actually true.
Oh, great, you made it. Hi, Bonnie.
So I asked Dr. Felitti if I could sit in while a patient met me.
A
mother of 2 in her 30s named Bonnie Ratliff agreed to come in for an appointment. She seemed a little nervous, but Felitti, tall and thin, sat down across from her, completely at ease.
The serious health or emotional problem that your mother had, can you tell me more about that?
She ultimately had a nervous breakdown, never recovered from it. She started drinking and smoking, and that's when the house became what you would see on a hoarder's house, on like a hoarder's TV episode.
And how did that affect you when you were a girl?
It was hard, it was especially hard because she made us keep it a secret.
And I see on the questionnaire that you were molested.
See the questionnaire? Very important. That's the ACE score.
Yes, I was, but I don't feel like there's any particular lasting issues there. It was one time,
It took about a half hour to go over everything. Some issues with irregular heartbeat, weight gain, allergies, an eye problem, in addition to Bonnie's childhood. Longer than a typical doctor's appointment, sure, but otherwise not that different.
You don't feel like you have to bear your emotions. If it's like just a checklist and you can just check off these things that have happened to you, yep, it doesn't feel so scary.
Felitti hadn't even mentioned the term ACE score or told her what hers was, 4 out of 10. But still, after the appointment, Bonnie said something had clicked into place for her.
I've done a lot of thinking about how my childhood experiences have turned me into the person I am, how I still carry them with me. I haven't necessarily connected it, for the most part, to physical issues before this.
And that's the point. Felitti says that asking patients about ACEs helps the patient understand their health better and the doctor understand how to help them. And it could potentially help the whole healthcare system understand patients better. That's according to Jeff Brenner, a family doctor in Camden, New Jersey.
It's still really the best predictor we found for health spending, health utilization, for smoking, alcoholism, substance abuse.
Brenner won a MacArthur Genius Award for his work on how to treat the most complicated, expensive patients in his city, often people with high ACE scores.
I can't imagine 10, 15 years from now a healthcare system that doesn't routinely use the ACE scores. I just can't imagine that.
Brenner only learned about
Remember
ACE
that
scores a
ACE
few years ago.
scores.
He says he regrets not integrating ACE scores into his practice sooner. But like most doctors, he says he was taught in medical school.
Don't pull a lid off something you don't have the training, time, or ability to handle.
Now, Brenner's trying to spread the word.
I have been in many, many rooms across the country full of healthcare providers asking, has anyone heard of the ACE study? And there'll be one or two people that raise their hand.
The few doctors I found who want to use ACE scores in their practice, like Brenner, say that figuring out how to do it is complicated. Will they stick to a checklist on paper like Felitti? Who will review the answers with patients? A doctor, a nurse, a social worker? And the biggest stumbling block, what does a doctor do with an ACE score once they have it?
You can't go back 40 years and make the bad childhood go away.
Absolutely not.
Richard Young is a family doctor in Fort Worth, Texas. He also trains residents in family medicine. He says he sees patients all the time who have lots of health problems and who had rough childhoods, and he's not afraid to talk to them about it. But Young's not convinced screening every patient for those things makes sense.
Someone's got to show me that it's going to actually make a difference in my patients' lives, and to my knowledge, no one has done that.
There is no research tracking how asking for ACE scores affects patients in the long term. The closest thing was an internal study at Kaiser Permanente in San Diego where Dr. Felitti did his research. The study tracked more than 100,000 patients in the year after they were screened for ACEs. It found that people went to the doctor 35% less often in that year, a potential cost savings in the billions. So why did people go to the doctor less? Maybe they were scared off by the questions themselves, or were they maybe somehow healthier? The study couldn't answer that question, but from his experience with many, many patients, Felitti chalks it up to something more spiritual than medical, alleviating shame.
A brief process, minutes long, in which one person tells another person who is important to them things about themselves that are shameful.
Things many of his patients had never told anyone, ever. Disclosing their secrets to him brought tremendous relief, Felitti says.
Sure.
Not unlike confession in the Catholic Church.
They leave with the understanding that they're still an acceptable human being, they're still part of the group. And I think we kind of stumbled into a lay version of the of that process.
A process of listening and accepting, but not necessarily treating a specific problem, which for time-crunched doctors eager to diagnose and cure is a role our healthcare system just isn't built for. Laura Starcheski, NPR News.
Okay, so that was very informative, as you can tell. She was her name was Bonnie Ratliff, and the mother of two in her 30s that was in the office. And the doctor asked her a few questions, and as you heard, it went pretty good. As Felitti talked with Ratliff, he went over the extensive customized medical history form she had filled out before the appointment, a form that included ACE questions. Felitti asked Ratliff about her mother's nervous breakdown and the drinking and hoarding that followed it. It was hard, you know. It was especially hard because she made us keep it a secret, is what Ratliff said. Ratliff also explained that she was molested once as a kid, although she didn't think it had affected her in a lasting way. It was only once. It took about a half an hour to go over everything, so it's quite time-consuming. But they were able to discuss heartbeat, weight gain, allergies, and eye problem, in addition to questions about Ratliff's childhood. It took a bit longer than the typical doctor's appointment, but otherwise wasn't so different. Despite the intimate content of the conversation, Ratliff never got upset. You don't feel like you have to bear your emotions, you know, Ratliff said afterward. If it's just like a checklist and you can't just check off these things that happened to you, yup, it doesn't feel so scary at all. Felitti hadn't mentioned the term ACE score or told Ratliff what her score was, 4 out of 10, but methodically had asked her how she thought each adverse childhood experience had affected her in her lifetime. After the appointment, Ratliff said that she had spoke with Felitti Something clicked into place. I've done a lot of thinking about how my childhood experience have turned me into the person who I am today, how I still carry them with me. She said, I haven't necessarily connected it, for the most part, to physical issues before this. That's the point Folletti believes. Asking patients about the ACE scores helps patients understand their health more deeply and helps doctors understand how to help the patient. According to Dr. Folletti, it is a great tool to have, and I hope that people paid attention. It's called the ACE scores. It's a questionnaire, a checklist of 10 things. I think doctors should utilize that on all patients, not only to find out health issues, but previous issues that parents might have had. I hope you enjoyed this show. Can't wait for the next one. May God bless you. And if you need to talk to me, 844-405-HELP. We'll talk real soon.